Hello, Rhode Island deaf and hard of hearing community. Today's topic is the updated coronavirus vaccine. Last month, March of 2024, the CDC put out a notice to the entire country that folks are encouraged to get the updated coronavirus vaccine. There's a 2023-24 vaccine available. And there are 4 groups of people that I'm going to describe to inform you about what to do next. If you are 65 or older, please get the updated vaccine. You might have had one last fall. Your doctor probably should have told you to get one last fall. Well, even if you got one last fall, you need a second one. Now, if you haven't had either, please go ahead and get the current one if you're 65 or older. The second group of people, and this is actually for anyone who is age 5 or older, should, and obviously that word means you are highly encouraged to get one updated coronavirus vaccine. For babies, 4 months to 6 years old, they should have more than one. And I should tell you that these are very, very small doses for small people. So for babies, the doses are very small. And for folks who have immunocompromised situations, if you're frequently sick, you should do whatever your doctor advises you to do. It could be that they're recommending extra doses because they want to protect your health. The most important thing is that everyone who's over 5 years old should get the updated vaccine. Let me talk a little bit about what we mean by updated 23-24 vaccine. You might remember we've had a number of vaccines over the years. There's monovalent, there's bivalent, there's boosters. Now, all of these words have been replaced. The new word that we're using now is updated. It's the updated COVID-19 vaccine. They have become more sophisticated. Pfizer and Moderna updated it in 2023. Novavax also updated theirs in October 2023. They've been approved by the FDA and the CDC. These are more powerful in terms of the current variant, and they're better than any of the previous vaccines because they do target the current variant. So if you missed one or two in the past, you need not worry. If you get the most current vaccine, you'll be protected. Senior citizens, as I said earlier, over 65, should get 2 of the current vaccine, 2 doses. People who have never been vaccinated, the CDC encourages you to please get this vaccine. The reason is to protect yourself. If you've never been vaccinated for this, it's okay. Don't worry about the previous vaccines. Go ahead and get this one. We strongly encourage that. The Rhode Island Department of Health has been looking at some of the statistics, and they've created a data hub. In Rhode Island, we have very low levels of the spread of COVID. Remember, we've had different levels, low, medium, and high in the past. Rhode Island right now is very low, and that's good. That means that the number of people with COVID or getting COVID is very small. However, with the updated 23-24 COVID vaccine, apparently only 17% of people have gotten that vaccine. And the Department of Health here in Rhode Island wants to encourage you to get that vaccine. I don't know if you remember Dr. Fauci. What he was really after was 85% of people getting vaccinated to create herd immunity. He really wanted to kill off the virus altogether, and herd immunity is one way to secure that. There would be no more spread of COVID. But unfortunately, we don't have a lot of compliance with vaccination yet. So I wanted to update you and give you some of that current information. Again, talk to your doctor first. Ask if the doctor thinks you should get the vaccine before you go and get it. And you have to make an appointment. Sometimes you can walk in. If you have any questions or any clarification, feel free to call me anytime or send me an email. My video phone number is right here on the screen. And my email is also right here on the screen. Thank you. Have a great day. Bye.